Greetings and welcome to Behind the Shadows. My name is Susan Finelli and I am your host and author of Behind the Shadows, a program where we go behind the shadows of what meets the eye. Today we will be going behind the shadows of hearing loss, and our special guest is Dr. Dominick Servedio. Dominick is a doctor of audiology. He is licensed to practice by the New York State Department of Education and is certified by the American Speech Language Association. Dominick, welcome to Behind the Shadows.
Thank you so much for having me.
It's my pleasure to have you. Why don't we tell our audience a little bit about your background and your practice?
Well, I've been an audiologist for 28 years. Decided to open up a private practice approximately 12 years ago. We specialize in hearing loss, and balance issues, and also with an emphasis on hearing conservation.
Interesting. And what is your educational background? Like, I remember when we first met, you said, well, I was either going to be a pizza maker or I was going to be a doctor of audiology. So how did you make the transition?
Well, I made the transition because I went away to college. I was the first one in our family to go to school.
Wonderful.
And just fell in love with the profession of audiology. Mm-hmm. Like I always say, you can teach someone how to do this, but you have to have a certain level of caring and empathy to really become a successful audiologist or healthcare professional.
Any healthcare professional.
Sure.
Well, you know, I've often heard that hearing loss is an invisible disability, because when you look at someone, you have no clue whether they're hearing you correctly or at all. You know, but if someone has a physical disability, it's very easy to identify. So I'm sure it makes it frustrating, not only for the person that has the hearing loss, but it's frustrating for the person that is trying to communicate with someone that's not hearing at the prime level.
Oh, absolutely. As you say, it is very, very silent. You cannot see the impairment, and there's two sides to that, because a lot of hearing impaired individuals will be able to mask the problem and just get through the day, right, and not really be identified. But then when you have a relationship with somebody and you're constantly being asked to repeat, what tends to happen is it will create stress in work environments, at home, in all social interactions with individuals.
Well, I remember when I was in grade school, I had a very good friend, Frances, and she was extremely hard of hearing. And in those days, they weren't hidden. You know, you saw it, had the wires. But I actually learned how to read lips with her because her speech was impaired because her hearing. And we became very good friends because I was able to communicate with her only because I was able to read her lips, because I found it very difficult, everyone did, to understand it. What is the connection, the hearing-voice connection?
Well, I mean, we're always supplementing with visual cues what's going on around us. And as a person develops a hearing loss, they also develop an ability to piece together information from facial expressions, body expressions. So there's definitely a correlation. Also, keep in mind that we're all using speech cues, reading facial expressions and putting it together with the context of the conversation. So to a certain extent, we're all supplementing our hearing.
Well, I remember I had an uncle who was very hard of hearing, and he used to say, wait, I have to put my glasses on so I could hear you. We were kids and we used to laugh at him all the time, like, well, you know, you hear with your ears, you know. But he said, no, I have to put my glasses on, otherwise I can't hear you.
Yep, happens all the time.
It happens all the time. Well, in researching the show, I'd like to read a quote I found from Helen Keller. And she said, deafness cuts off one from people, whereas blindness cuts off one from things. And it's a very different loss. Yeah, it's a very different loss.
Yeah, I mean, she also made a comment that if she did have a choice between being blind and being deaf, she would definitely take blindness over being deaf. Yeah. And you know, and those of us who are fortunate enough to have all our senses, we don't realize, you know, like to make a choice. If someone said to you, would you want to see or hear, you know,
I think immediately I would say I want to see, but for someone who had lost both senses, it's an interesting comparison. No, I'd rather hear than see.
A little known fact, hearing is so much more complex than vision. And that's why there's so much more of a struggle in terms of correcting a hearing loss. So yeah, I mean, in terms of complexity, there's so many different facets to hearing that are not in vision.
Right. Well, before we discuss the causes, I'd like to discuss a little bit. When we first met, you told me, you really hear first with your brain, and then the ear. So let's talk about that. I know that you said the brain is the center of hearing. Talk a little bit about how the brain controls your hearing.
Well, essentially, the ears are delivering the signal to the brain, and then the brain is going to process all the nuances when somebody is talking to you. So the ears are really the delivery system. You'll have a patient that will come in, and they will have a 10% hearing loss, which is not a great deal.
Right.
But then if you start to do some more fine diagnostic testing, you'll find that they have a processing ability of 40%. So 40% of what they're hearing is what they're understanding.
Right.
So that's why that's really the core, the brain.
The brain. So the brain interprets the sound. It interprets it, so it must be accurate.
Well, it's not so much that it has to be accurate. If it's fed misinformation, it's only going to work with what it's given.
Right.
Yeah.
Right. So I know that we hear in all dimensions. So when we hear from across the street, it's very different than you and I hearing each other. The brain is processing it different, or is it hearing differently?
No, it's the brain.
It's the brain.
The brain is able to differentiate localization. Where's that sound coming from, right? You've got both hemispheres of the brain working together and communicating. You've got two ears. Very often when someone has a unilateral hearing loss only in one ear, one of the first things that they'll complain about is, I can't tell where sounds are coming from because everything's going into my better ear.
Yeah, I notice people, they like this, and I wonder if they even realize, like before they've come to terms with the fact that they have a hearing loss, I don't even think they realize that they're turning to the good ear when they're listening to someone.
Yeah, I mean, you do it subconsciously, absolutely.
So the brains hear, not the brains, but the ears, they hear equally. Let's say someone has 100% hearing capacity. Do the brains hear equally?
Well, the ears deliver the signal. The ears will deliver the signal equally to the brain, but it's how the brain processes the information that may differentiate. That's why you'll notice an individual that has equal hearing in both ears, but they'll still localize with one ear. Right.
Yeah,
that's to aid in processing the information.
I see. So the brain is really directing the ear to say, wait, I need more information?
Right,
Is that what's happening?
Yep,
subconsciously. Okay. Let's talk a little bit about the causes of hearing loss. When we first met, I said to you, well, hearing loss seems to be an epidemic in the aged, and you said no.
No, it's basically a myth that you're getting older, you necessarily need to develop a hearing loss. There are two major factors that we have identified: hereditary issues and environmental issues. In modern society, we all basically have the recessive gene for deafness or hearing loss.
Oh, we do.
Yeah. So when we have a couple that has an offspring, and if both recessive genes just pop up, then you're more prone to the hearing loss. Also, what happens, and this is where the confusion is in terms of I'm getting older, I'm losing my hearing, is we live in a very, very loud world. Our ears have never evolved to the point to be able to handle the amount of input and stimulation. Now, with the advent of all of these music players and listening to construction equipment and all of that, the ears are just constantly being bombarded. They are extremely fragile, and it doesn't take a lot of exposure to do some permanent damage.
So hearing loss in the elderly, it's really damage from all the years of living and listening
Exactly.
to music or noise.
Or just loud, high-intensity sounds.
Right. But, well, you and I were talking before we came to air about, many times I'm in an elevator and I see young kids, they're plugged in with their music, and it's so loud that I could hear it across the elevator. And I want to shake them and say, you're deafening me. God only knows what you're doing to your own ears.
Yeah,
Right?
absolutely. When we're born with an excessive amount of nerves in the ear. So as we start to deteriorate, and if we lose 100 what they're called hair cells, lose 100 hair cells here, 100 hair cells there, it doesn't really add up. But have 10, 15, 20 years of exposure, you actually start to find dead zones in the cochlea, which is the end organ of hearing. Now, when you see an individual and you're riding the train or you're riding, as you said, the elevator, and you can hear their music, well, they're basically doing damage. And what you'll hear from a lot of individuals is they'll come out of a loud environment and they'll chuckle. Oh, I hear my ears ringing, tinnitus. Well, tinnitus or tinnitus, they're interchangeable. That's the brain telling you, that's your ears telling you that they've been overstimulated. And then it takes a couple of days for it to settle down, and then your hearing comes back. But you know what? The damage is done. It's permanent because the hair cells in the cochlea do not regenerate. Once they're dead, they're dead.
It's interesting. My mother, and as you know, she's 91, but sometimes she says when it's very quiet, it sounds like a steam radiator in her ears.
Right.
And is that what that is, tinnitus?
Well,
what is that?
Tinnitus is a mystery from the standpoint of origin. We really don't have a good grasp. It's much, much easier to say almost anything and everything. Chemical imbalance, diet, exposure to loud sounds, medication, lifestyle. This will all contribute to developing tinnitus.
Tinnitus, and that's what that is. Well, you and I were speaking about the New York Times article yesterday. Why don't you talk a little bit about that?
Yesterday there was a New York Times article, and it was referring to this campaign that this football team, NFL football team, has started screaming, and they plaster it. Scream as loud as you possibly can. Well, some organizations have gone in there with sound level meters, measuring it, and it's louder than a jet airplane taking off.
Oh my.
And I personally, I feel that we're looking for a lawsuit. They're going to open themselves up to a lawsuit. A number of years ago, several of the MP3 little personal listening systems, one of the things that they were plastering in their instruction book was play it loud because we can handle it.
Really?
And I'm not even going to go into the detail of what our organization, the American Academy of Audiology, went through to get that little piece of information taken out of their user manual.
Don't they have lawyers?
Yeah, they have lawyers, but you're going up against some major companies here, and you would think logically, of course.
Logically, but I would think that a lawyer has to read everything before it goes out, and a lawyer would say, well, wait a minute, this is, you're open for a lawsuit. You're exposing yourself here for a lawsuit.
Yeah, absolutely.
Interesting. Well, I know people that come back from the war, because I have a cousin who was in Vietnam. And he has very bad hearing problem, and he swears it's from the war, from the gunfire, from the war, and that must be like very close to the ears, and depending on where they are. So there's that. So for hearing loss for something like that, is that damaging? Is it a damage to the ear?
Absolutely.
Yeah.
And you only need one exposure. I know that you were referring to the military, and now the military has gotten involved in giving ear protection out.
Okay.
But if you're standing, you don't even have to be standing next to some of these shells that are going off. I mean, you could be several hundred feet away. The intensity and the repeated exposure will give you permanent hearing loss. I had an individual a number of years ago, and this is in 28 years I had never seen something like this. A young man had gone to a concert, a rock concert. He happened to be sitting in the orchestra. In one night, he developed a 95% hearing loss.
Oh my.
Permanent.
Oh my.
Permanent hearing loss.
Oh gee. Were you able to help him with hearing aids?
We were able to help him with hearing aids, but you just can't help but feel so devastated from the
gee.
standpoint that this was completely preventable.
Oh my, that's it's terrible. Let's talk a little bit about how head injury can affect your hearing.
Okay, so the cochlear, although it is fairly well protected, you can have what's called an acoustic trauma,
Right.
where in a car accident, in a sporting accident, you can damage the cochlear. I mean, you can literally dislodge the nerve cells from inside the cochlear. You can also break bones. There are 3 little bones in the middle ear. You can fracture them.
You know, you just take so much for granted, because researching for this show, head injury, how is that going to hurt your hearing? You know, you just don't realize the repercussions one thing can lead to another. Let's just briefly talk about diseases, not going into too much detail, but I know there are diseases that can affect your hearing. What are they? I know meningitis, is spinal meningitis, can that affect your hearing?
Absolutely. I mean,
Yeah.
spinal meningitis, it's not as prolific as it was at one time, but there are ototoxic drugs out there. Individuals that are on chemotherapy or radiation, they must constantly be monitored.
Right.
To make sure that the chemicals that are in their body are not killing off the hair cells. So you've got health-related issues. Of course, we spoke about environmental
Yes.
issues, high blood pressure. Diabetes, a very, very, very big problem with diabetics, because the cochlear is so dependent, and the nerves are so dependent on a certain level, a sugar level. And when the sugar level spikes or drops, the hair cells will die off.
Yeah. It's absolutely amazing. Let's talk about the psychological impact of hearing loss, because no two people have the same reaction to an adverse situation. And I'm sure it's a very disorienting experience. And I'm sure in your practice, you have to deal not only with the hearing loss, but with helping people overcome the psychological impact of hearing.
The psychology of the hearing impaired is absolutely fascinating and very, very complex. Studies upon studies have shown that a typical individual that's developing a hearing loss will go through certain stages. Denial. Well, it's not me. It's the other people. They're not speaking as clearly. Oh, I remember actors in my day, actors would be able to articulate and you would be able to understand them. Okay, it's because you talk to me from the other room. It's because you turn around. So it's projecting, denial.
Right.
Then there's a segment of anger. You know, why me?
Right.
And then finally, what happens is the acceptance stage. The acceptance stage, from the point that someone will start to acknowledge or other individuals will notice that they're developing a hearing loss, to the point that it's dealt with, is approximately 3 years.
And, oh, wow. That's a long time.
It takes about 3 years.
Yeah,
Yep.
I'm sure it does. And I'm sure that people get depressed and before they finally accept.
Well, there's depression, there's withdrawal. I don't want to go out to dinner. I don't want to socialize anymore. A lot of these pseudo-coping skills, and they're real, and they're pretty devastating.
Oh, yeah, I'm sure they are. Now, the difference between, in your practice or in anyone's practice, dealing with children with hearing loss and adults with hearing loss, because I'm sure I see some very young children with hearing aids. They must be 2 or 3 years old. How do you as a doctor cope with treating a child who really doesn't understand what's happening?
As I was saying earlier, I've been doing this for 28 years,
Right.
and when I have a newly diagnosed child, it still devastates
Still
me.
hurts.
It hurts.
Still hurts.
It hurts. But the flip side of it is when we treat it and deal with it properly, and you watch this little individual that was isolated all of a sudden light up. You light up also.
You light up with them. Yeah, you light up with them. Let's talk a little bit about, I read that people with hearing problems get fatigued before they've treated it.
Well, even after it's been treated, because retraining the brain to be able to hear once you start to treat them, it's fatiguing.
Yeah.
It's absolutely fatiguing. And of course, if you're not being treated and you've got the hearing loss, well, you're constantly staring at the individual. You're looking for any cues you possibly can. It's not a relaxed environment at all.
And it must be anxiety-ridden also.
Absolutely.
And then when one takes their hearing aids off, it's like a switch
Isolation.
goes off. Yeah, because they can't hear.
Yep, yep.
It's. I've also heard people talk about that when they take the hearing aids off and then they can't hear, but they feel better without them because of the amplification from hearing aids. Do you see that a lot?
Well, you know, typically if someone is taking them out and saying, oh, I'm so relieved at the end of the day, well, typically they're being a little over-amplified because the initial period, which is about 3 to 4 months until the brain really accepts the information, that's probably the most difficult period. But then what'll happen is try to take those products away, take the hearing aids away from someone. After that point, for instance, it needs to be adjusted, it needs to go back to the manufacturer for something, and you've got a pretty angry individual on your hands.
And it's not like the car companies where they can give you a loaner, right?
Well, no, actually, we have loaners.
Oh, you do have loaners.
We definitely we have loaners, so we lend people their product, but. You know, the person that 3 months ago was really coming in, kicking and screaming, now all of a sudden you're taking their instrument away. They get pretty stressed out.
And in the beginning, I'm sure there's a vanity concept of one using hearing aids. I mean, they're very different than they used to be, because, you know, I as I said, the girl I went to school with, it was the 2 wires and the little boxes, but now they're practically invisible, and some of them are indeed invisible.
Yeah, absolutely. And also, more often than not, what happens is society really is not passing judgment on you. It's something that you're doing to yourself. Again, this myth about I'm getting older, end of life issues, so now I have to wear hearing aids. But for the most part, people could care less.
That's right.
And they also do not stand out.
That's right.
Like they used to do. They don't stand out. I mean, you can really camouflage them rather well.
Well, this is a good segue in. Let's talk about treatment. How you treat people and the types of devices, and when implants are necessary.
Well, let's take this backwards. In terms of cochlear implants, which is a surgery, that's a last resort. Essentially, what the FDA has said is that if you cannot be aided by hearing aids, then you are a candidate for cochlear implants. In terms of the multitude of options with hearing aids.
Well, let's just stay with the surgery just one more second, because how effective, how successful are those surgeries?
It's unbelievably successul. It is very time consuming and it's very, very stressful. Actually, the easiest component is the surgery. Otolaryngologists can pretty much do the implant, and then they're gone. They're not in the picture anymore. Then you've got social workers, you've got audiologists, you have speech pathologists that you have to visit for at least a year.
So you come in at that point after the surgery. Okay, so let's talk about how you treat your patients. So someone comes in and says, you know, my husband told me I'm losing my hearing, but I'm not.
Well, very often what we suggest is that you do come in with a significant other, because we, at this point, at this initial stage, need to really learn and bond, all of us.
With the family.
With the family, and get an idea. A good audiologist is not going to just be looking at their ears. We're looking at all of the dynamics that are going on. You know, what is it that you want to do? A person that just wants to sit at home and hear their TV better is very, very different, and is going to be treated very differently from an individual that's in the business world and going from meeting to meeting and very, very active. So first of all, we deal with the psychological aspect of it. And what I mean by that is just getting a feel for where the individual is. I've asked and I've told many potential hearing aid wearers that are perfect candidates that they're not ready. Because although audiologically, diagnostically, you can be fit with instruments, if psychologically you are not ready to proceed, we're not going to succeed.
Right.
We're not going to succeed. So we get over those barriers. And my perfect patient comes in and says, you know, I'm not happy that I've got a hearing loss, but I realize and I've gotten over some of the stigmas in my mind, and now I'm ready to do the treatment plans.
And quality of life. They find they have a much better quality of life for the whole family, for everyone in the household.
It's across the board.
Yeah.
It's across the board because although the individual that has the hearing loss is the one that's really suffering, it does trickle down. I mean, the kids can't talk to grandpa, or the kids can't talk to their parents.
Yes, yeah.
And family and friends will start to back off.
Well, you know, it's interesting. I was at a luncheon the other day, and there was a speaker. And you know how when you're at these boring lunches and you kind of whisper to people because you're not really paying attention? A woman 2 seats away from me was speaking very, very loudly. And I said to myself, I bet she has a hearing problem. Because she's not a rude person,
Right.
but she was being extremely rude because I think she thought she was whispering to the person between us. And I said, I bet you she has a hearing problem.
Yeah, we're always judging the way we want to be, the way we want to project.
Right.
And if you can't hear yourself, obviously, you're going to
bring it up.
You're going to bring it up.
Yeah, you're going to bring it up. So talk a little bit about the types of hearing aids. And I hear we're getting cued, so very quickly talk about the hearing aids. We're getting cued to wrap up.
I think the biggest advancement that we have now, aside from the cosmetic, we're not going anywhere else in terms of the cosmetic, but in terms of instruments that can do a lot of thinking and processing for you, so that the patient has to do less and less. That's where we're going right now. The technology is moving towards a product that will self-adjust. And another thing that's coming down the pike is being able to program the instrument in your living room, where I stay in my office and you put and we can program it right through your computer.
Well, quickly, I just want to tell the audience that when I did visit your office to get ready for the show, I saw that you could see immediately when someone had their hearing aids on or off. But Dominick, I'd like to thank you for joining us. It was a pleasure.
My pleasure.
And I'd like to thank you, our audience, for joining us. If you have a question, you certainly can contact Dominick directly. If you've missed any of our shows, you can go to my website at behindtheshadows.com and click on Public Access Television. If you have a topic you would like us to discuss, you can contact me at Susan at behindtheshadows.com. And until next time, remember, the brightest light shines behind the shadows. Thank you. It was a great show.
Thank you.
You did a wonderful job. You really did. You did a wonderful job. Yeah, it was great.
That's great.
And very informational, right? It was really good.
We should do one.